As I just mentioned, my buddy, and I call him my buddy, Dr. Brad Wenstrup, he was a member of Congress, representative from Ohio, and he is now Executive Director of Americans for Health Excellence. Brad, thank you, my friend. Good to see you. Wonderful. I see you have a heart out right now. It's at 12:45, so apparently you gave me a little extra time, so thank you.
No, we're good. We're good.
Yeah, no, I've been having too much fun up here. I haven't had a bathroom break yet since like 7:30 this morning, but we're having fun. So, Brad, you know, I don't know how much of you this have heard, but we've had really great time, thinking. We've had legislative, we've had John Brooks in from CMS, we've had people that are from ARPA-H, Alicia Jackson, people that are trying to shake up the healthcare system. We have some great sponsors here today, Lilly, HDA, BD. Everybody's out here trying to say, if we're kind of, declutter the performance of the American healthcare system, make it better, smarter, invest in the right things, not invest in the wrong things, get it right. You're right on the forefront, and you've always said what the title of this session is, putting patients first. So would love to hear what you think we need to do to make the American healthcare system better.
Well, one thing that I want to remind everyone...
I got to remind you, he's a war hero too.
Well, yeah. Thank you. But what I want to remind everyone about is, and this is something that I've said at medical school white coat ceremonies and medical school graduations, and I think it pertains now, and this is before AI came around. I was always saying to the graduates, nothing can replace the pat on the back and the holding of someone's hand that says, I'm going to take care of you. And I think that that's something that we need to keep in mind. But it is about getting all that we can to the physicians that are with the patients, that are taking care of them. What kind of data, what kind of resources, what kind of pharmaceuticals. We need the innovation. We need to be the leaders in innovation. And with my intelligence committee background and military background, I consider our health to be a national security issue. And that as a country, we need to be the leaders in innovation of new drugs and not an adversary of ours. And it comes to manufacturing as well, and the quality of our medications and all the things that are on the horizon. It's going to be best for America if we lead on that. We need to continue down those roads.
You were in Congress. Has Congress been negligent?
I don't know if Congress per se has been negligent unless you look at things over the last 50 years in a lot of ways where we let things go. If you'd have told me when I was in Iraq as a surgeon that my protective equipment and my pharmaceuticals relied on an adversary, China, how did we get here? How did we get here? And while still in uniform, I was working with the Defense Medical Logistics Supply Chain Council. And we were identifying everything that we use, where we get it, all the way down to the active pharmaceutical ingredients. And, we had a trust maybe in China, but that's not the case today. We need to bring these things back. We need to have them domestic. We need to have them in more than one location. So we really have to invest in that. And I see across America, people are stepping up. But there's a lot of things that have concerned the American patients over the years, but especially what I saw in a recent poll where we saw Republican, Democrat, independents. They don't like what's going on with insurance companies. They have trouble dealing with their insurance companies, the cost, the denials of care, the delays in care that they have to deal with. And then one of the other issues has been around for a while, but now we're seeing some action take place, is the most favored nation, where other countries are paying less for the same drugs that we have. We're being exploited here to the benefit of others, and they're trying to balance their budgets by American taxpayers having to pay more for their drugs here. So these issues are being addressed, and I'm pretty excited about it. And it's exciting now out of Congress to still be able to work on policies like that.
And I just want to say again, for those of you who are standing, I love you. I see my friend Chris. I see all these people over here. So my team, Widehall team, help folks find the seats because they'll feel braver taking a seat if you're helping them than coming up. So you're not interrupting us. So I just want you to know, as I worry about the lady holding the tate bag. So come on up, come. Your arm's going to get tired. So come, this is about you too. I care about all of you. So
well, she's with me.
Oh, I know. I had breakfast with her this morning. Come sit up here in the front. He'll be happier. So We had a discussion about API earlier, but I mean, I think part of it is you outlined extremely well, the heart attack that we had during COVID, understanding, okay, we're really dependent upon China and other countries for a lot of the key ingredients for our stuff. I've talked to these industries and they say, look, we want to come back, but what matters is long-term pricing, knowing there's demand, getting the economics right. Why can't the United States just do that?
Well, I think we can, and I think you're going to see it start to take place. The United States itself is a big customer, and that's part of it too. So when you can get something cheaper overseas, there was a tendency to do that, right? And I really don't care necessarily if China is making a toy that my kid plays with. But when it comes to our medications and our protective equipment and those types of things, we got to be prepared. As you know, in the House, I chaired this select subcommittee on the pandemic. There's a lot of lessons learned in there. And so what do we have to do going forward? And what's the return on investment? The return on investment is better health for America. Because to me, when we talk about any program, what does success look like? You can say we got more people insured than ever before, but if Americans aren't healthier, what have we accomplished? So what are we doing as far as prevention and new innovations, new drugs, new treatments, new cures? And let's be the leaders on that. And then to go to really the national defense side of things is, what are we doing with countermeasures? Are we prepared? And I'm seeing good things starting to happen with Ebola, keeping it from coming to this country for one thing, and then also being able to help others that have the problem and deliver the medications, the countermeasures that not only can take care of them, but can take care of Americans. And so, again, we have to be the leaders, and I think that leads to a better, more peaceful world when we are the leaders.
Well, we had a breakfast this morning with your excellent staff members, Callie, there, and she was there in this, and we were discussing a number of things, but also insurance. And one of the elements is, Lilly, not being nice to them, but I think in many of the areas that are new drugs and therapies that are changing the game for some people, obesity drugs, et cetera, early detection, biomarkers, Alzheimer's, early possibilities and treatments, when you can come in if you get earlier treatment. But guess what? The insurance coverage of those needed things that might be, again, I think about tectonic plates that might move a plate pretty significantly are often not and usually not covered by insurance. I'm covered by insurance. Lots of the stuff that I think I need is not covered by insurance. So there's an illusion out there in the insurance space. And I'm interested in how Americans for Health Excellence are dealing with that quagmire.
Well, we're definitely talking about it, for one thing, and I wrote an article. I actually sent it to you this morning, but you were probably up and running already.
That's why I'm asking you that question.
And talking about how decisions are being taken out of the doctor's hands and the patient's hands, and they're being made by insurance companies. A lot of them, they say not covered. They're not. It's not that they won't cover them. They're denying them. And they're delaying them and saying, well, no, that's not appropriate for this patient. When what we have, the problem is across the board, and most doctors can tell you about this. When you have people that are never seeing patients telling you what you can and can't do for your patient, it is a problem. And it leads to a huge anxiety for patients because they don't know what's going to be covered, what's not going to be covered, if you're even going to be able to take care of them. And there's nothing more frustrating when you lay out a plan with a patient and then the insurance company says, I'm not going to allow that MRI, for example. Well, how am I supposed to take care of the patient if that's my diagnostic tool that I need? And the big problem is they don't see the patient. And I wrote in that article, and I've done this many times, when I'm talking to the person on the other end, a physician or whatever, I said, well then, if you're gonna deny this, you're now taking care of this patient, I would like you to see the patient. And they go, well, we can't do that. I said, well, I want your medical license number. I'm putting it in the chart because you have made this medical decision that they don't need it. You should have some liability. I don't know where the trial lawyers are. It seems to me, and Mark Cuban just said something about this recently, that's like, why are they not responsible if someone is harmed by the delay and denial of care? This is a real problem, and this is the type of stuff that we found in our poll that is popular to go after across the board, Republicans, Democrats, Independents.
One of the other things that I've been interested in, you talked about the MFN stuff and drug prices, et cetera. And a lot of times, because we'll know a brand, we'll know a Lilly, we'll know a Novo Nordisk, we'll know an AstraZeneca brand. But what I've also learned in this murky world, and you're part of that, is how a drug gets a price has a lot of constituents that are part of that. A lot of culpable players in it.
Right.
PBMs, insurance companies, rebates. It's horribly complex. And I'm just interested, sometimes I think we talk about drug pricing in a way that's sort of divorced from the ecosystem that it's in. I sort of feel like, as I said earlier today before you were here, we need a Schoolhouse Rock video that's not how a bill gets a law, but how a drug gets a price, to kind of show all the different dimensions. Why can't Congress, that you're at, create greater awareness about that ecosystem and figure out how you make that healthier?
Well, I'm not sure that every member of Congress is aware of that ecosystem to its fullest.
But you were the Doctors Caucus.
Yeah.
You guys were the people.
Oh, yeah.
And we had Rich McCormick here earlier. Who's
He
in the
did a great
Doctors
job.
Caucus. Yeah.
I watched that. You're always trying to thread the needle when it comes to innovation. Look, I know so many people that had great ideas and their drug never made it. It failed. But they go on, they keep fighting, and then maybe they get one. So there's that. There's a lot that has to go into research that obviously affects the pricing of the medication, at least until it becomes a generic. And so you have that component, yet you want it to be able to be out there in the market. You want people to be able to use it, especially life-saving drugs. So you're walking that fine line when it comes to pricing. But when you have people in the middle that are making money and to reduce the cost, but that's not passed on to the patient, we haven't helped ourselves.
Right.
That's the problem. And so we need to make sure that if there's going to be an opportunity to get something for less, like with Trump RX, which was very popular as well, we had members of Congress that were getting some medications from...
Just tell the audience, because not everybody, I think Trump RX is incredible innovation, but a lot of people have never heard of it. So we're going to talk to Callie Means about a little bit more marketing, but tell people what happens with Trump RX.
Yeah, well, basically you can go online and find how you can get your medication for cheaper, sometimes direct from the manufacturer, and you've cut out the middleman.
It's like Lilly Direct, but it's through Trump RX, et cetera, which is, I think, a big innovation. In our last minute, Brad, if there's one lever you think we can collectively pull to, jump forward, what would it be?
I think it's pulled forward by awareness. And when you asked about Congress, if the American people are made more aware, which is what we're trying to do with Americans for Health Excellence, made more aware of the situations that are in play, then if constituents know, then members of Congress will know, and then there's actions that maybe they can take. But there's things that we can do outside of Congress as well to reduce costs, increase accessibility to your caregiver, and make it affordable.
Well, I want to thank you for joining us, Brad. Fantastic friend and former member of Congress and Executive Director of Americans for Health Excellence. Keep us posted. Please come back when we do this a year from now. But thank you so much.
You know where to find me.
Thank you, my friend. Thank you. Thank you. Good to see you.
See you.